Hi, my name's Karen Sherman, and I'm with the quality team with Hamilton County DD Services. I want to spend a few minutes today providing some information about electronic visit verification. As we go through this, keep in mind that this is just an informational training and not the one that's required by Medicaid. Also, as we go through this, you will have access to the PowerPoints that you can print off and follow through as we go along. As we go through, we are going to talk about EVV as an overview. We will discuss the state deadlines and implementation for EVV, potential implications for providers, and also how we plan to share information with providers about EVV, which we've already sort of done and completed. Just an overview of why EVV is coming into place. EVV is part of a federal mandate through the 21st Century Cures Act that came into place December of 2016. As a part of this requirement, it mandates that state Medicaid programs are required to implement the EVV system for personal care and home health services. The documentation has to have some pretty specific requirements, which include who's receiving the services, who's providing the services, where the service is being provided, and the date and the time that that service is being provided. The reason we are enacting this through Ohio is because if we do not follow the federal guidelines, Ohio will lose money. So they are invested in making sure that we implement EVV timely. And our time restrictions is through Ohio is that it has to be implemented by 2020. So EVV is a tool for electronically capturing point of service information. Ohio uses a GPS-based data system called SANDATA, which we'll talk about more shortly. So EVV, the purpose of it is to capture the start and stop time of visits, what service is provided, and who is providing care. And it's going to standardize that data across systems. So for other states that do not have IO Level 1 waivers and HPC, they'll be able to figure out how many hours we're providing of a like service throughout the country. So it's a way of standardizing data nationwide. All right, as we move from the federal to the Ohio requirements, ODM, Ohio Department of Medicaid, selected SANDATA to capture the vendor requirements for electronic visit verification. Agency providers are able to use other vendors to capture information, but SANDATA is the one that's approved by Ohio automatically and the one that's free of cost to providers. So SANDATA provides to individuals who the EVV applies to, which we'll cover in a little bit. Individuals will receive what looks like an iPhone device in their house to capture the information. And so a provider will request an EVV device through SANDATA. The device will be delivered to the individual's home. The provider will use the device to clock in once they begin providing a service. It will document the location and the time. When the visit is ended, they will select again that they will sort of clock out in the system. So SANDATA is providing all of the technical assistance for the device, and they are also doing the data collection. It's free service. They have 24-hour support for providers. They are also have developed a mobile application that you can download on your smartphone, so you don't have to have the device with you in the community. That's another option. I already talked a little bit about starting and ending a visit. So for agency providers, each DSP will have a unique identifier. They will have to log in every time they start a visit. They will select that they're providing HPC or IO waiver nursing, and then they will start a visit. When they leave, they will do the same process to end a visit. So for the implementation timeline for EVV, Phase 1 has been in effect since 2017, and that included state home health plan services and Ohio home care waiver services. Phase 2 goes into effect August 5th, 2019, which includes DODD 15-minute unit providers. So if you're providing HPC and billing 15-minute units, that would apply. Also, IO waiver nursing applies from our area. In Phase 3, self-directed supports will be included. Excluded services are any services that are billed using the daily billing unit or monthly rate calculator. On-site on-call is also excluded from EVV. Shared living is excluded, and all types of respite and ADA services. We would like to point out that for individuals that are on the daily billing unit, our monthly rate calculator, which are individuals that share services across a provider, if an individual should move out, and so the individual is only receiving one-on-one services at that time, the provider would have 2 days to request an EVV device. So there's a very short turnaround. If that device isn't selected, the provider would not be able to document a visit, then bill for that visit, which would result in a potential lapse in payment. So for phase 2, which goes into effect August 5th, 2019, for individuals that receive HPC 15-minute units and IO waiver nursing, there are various trainings that will be offered. For agencies, there is in-person training at 6 locations, and each agency provider is permitted to take two staff people at the administrative level. There will also be live webinars that cover 4 different topic areas and last about 2 hours each, so about an 8-hour training. Additionally, for those sessions, that you can bring 2 people per provider Medicaid number. For independent providers and also agency providers, direct support staff, there's an online approach with self-paced training that you can log on to online. Registration is now open. It opened April 1st, and training began this week for phase 2. It began on May 6th, 2019. For phase 2, if an agency operates using different provider numbers, so they may have a residential provider number and they may have a separate provider entity that does ADA with a provider number, they must satisfy EVV requirements for each provider number, although that's probably not the best example since ADA is not covered under EVV at this point, so sorry about that. For agencies, they are expecting that the train-the-trainer model is being used, so that there are 2 people that go to the in-person training or attend the webinar training, and they use this information to train direct support staff on your specific agency policy and requirements. Agencies are also able to use the webinars or the trainings, the webinar trainings, to train direct support staff as well. All right, so we began sort of talking about EVV a lot more in depth with providers in March, which is where you see now. We talked to individuals about EVV. So what we learned from phase 1 is that individuals had EVV devices, the SANDATA devices, delivered to their home, and they didn't know why that was happening. So we asked all SSAs to reach out to individuals and let them know EVV is coming in August. Providers will be requesting a device and it will be delivered to your home. And we also shared some informational videos and just some general information about EVV. We also reached out to all providers that we thought would be impacted by EVV, and we did this through my team, the quality team. We sent an email out to all providers that we thought would be impacted. And we also asked SSAs to reach out directly to providers so that they could learn about EVV. We also think this is a great time to make sure that your provider information in MITS is correct, because they have also been communicating about EVV through your MITS email address. And I will give some information in a little bit about how to make sure that that's correct. Currently and in April, we expect that providers should be registered for training through EVV. And my next slide shows you a little bit of where to locate that training. And then May through July, make sure you're completing that training. Receive login credentials, set up the individuals that you support so that they are in the system, order devices, provide staff training, and begin using EVV as soon as you get access so you can work out those glitches. So phase 2 timeline is located on Medicaid's website, medicaid.ohio.gov/initiatives. If you click on training, you will see that there's phase 2 provider training available towards the bottom middle of the screen. Make sure you select appropriately whether you're an agency or non-agency provider. Some changes between phase 1 and phase 2. For phase 1 providers, individuals have to verify a visit. That is not the case for phase 2. There is no verification from individuals or family receiving services that the service was provided. We also know that eventually claims will need to match with EVV. So if claims do not match, you will get an error in EVV and expect that it be created. But at this time, we are being told that claims will not be denied until later summer. I already talked about this a little bit. So when claims are submitted by a provider to DODD, DODD will query SANDATA to identify a match for that request. If a match cannot be located, an error will be noted. So it either says no or yes, that an EVV records does or does not exist. If you as a provider stop providing service to an individual, or an individual no longer wants to receive services, you need to contact EVV to return a device, and the individual will receive an envelope in their home to put the device in to return it to Medicaid. We also have a lot of questions about, so what if a device is lost? What if it's broken? What if it's destroyed? We are told they're relatively indestructible. But if something does happen, you can request a new device. It doesn't cost the provider, it doesn't cost the individual anything. Same as if the device is lost. ODM, Ohio Department of Medicaid, uses MITS for contact information to give you information about trainings with EVV and just information about what's going on regarding claims, billing, and errors. MITS stands for the Medicaid Information Technology System, and they're sending information through email, text messages, and we are also told that providers are receiving recorded voice messages to their provider numbers that are located in there as they're trying to share information about EVV with providers. As we were planning for EVV, because we know it has a big impact in our community of providers, we really wanted to meet with our provider community and see what their thoughts are, what their concerns are. So we were able to summarize some of the high-level concerns that many providers had concerns about. There's concern that DSPs need to have a unique email address to attend the training and to log on to the EVV device. And so sometimes maintaining an email address or checking email is not something that that DSPs do regularly, so that was a concern. There's also the concern that DSPs work for multiple agencies and they'll need multiple IDs, and just remembering that can be cumbersome at times. Additionally, all DSPs must receive training prior to receive login credentials for the EVV system, so just another training requirement to remember hiring and just another delay in getting DSPs out providing direct service we know is a barrier. Another thing that we heard that isn't on this list is that some DSPs just feel like this takes away from providing direct care to individuals, and so they will leave an agency and look for an agency that doesn't have this requirement. So we recommend doing some pre-training with your DSPs to make sure that they're aware that this is a requirement throughout the field, and that they will find that other agencies are requiring the use of EVV as well. I already mentioned that once you begin providing services with the individual, you will need to request a device within 2 business days after the first service is provided, otherwise claims will be denied. Similarly, if you're no longer providing services and will not be providing them in the future, you will need to return the device within 48 hours. We know that all this will require an increased administrative work and oversight to deal with the glitches and respond to errors and discrepancies between the claims and what is documented in EVV. So we think that that will also be taxing for providers. There are some common misconceptions out there. EVV is not required to be addressed within the body of the My Plan. The team needs to have a discussion about EVV and if the individual is going to be using the device or using the app. So that needs to be identified in TCM preferably. And below there, I've also included a video that you can share with individuals that might help answer some of their questions about EVV. As we've gone through this, I've recognized that I failed to mention, so say a DSP or a provider forgets to start a visit, then they figure out 2 hours in that they've been providing services but never actually started a visit through the EVV device or SANDATA. They can always go in and manually enter the start of a visit or adjust the start time and just develop a reason for that. All right, we want to talk about how EVV is impacting Hamilton County. We know that approximately 1,500 individuals will be impacted by EVV, 1,492 to be specific, and most of those individuals have the IO waiver, just over 1,000. and 441 have the level 1 waiver. So we know this will impact our system largely. We also know that it will impact providers largely. There are almost 474 providers impacted, 157 of them being agency providers, and I can't read that number, 317 independent providers. So a large number of providers will be impacted. So we want to make sure to share the information so providers are prepared, they get trained, and that we ensure that EVV is, when it goes into effect August 5th, that providers are able to bill, they're trained, and they're prepared. So we are really trying to share information with providers and make sure they know what is going on. I've already talked about our communication plan, sharing information with SSAs. We've also been updating providers through the provider newsletter, provider forum. We've done a lot of these trainings in person, and we wanted to make this webinar available for providers that couldn't attend the in-person training. So things to be doing. Make sure your information in the Medicaid information technology system is up to date. If you have questions or have issues, you can call the provider hotline at 1-800-686-1516. Make sure you're reviewing information and correspondence from Ohio Medicaid to know when trainings are announced, and make sure that you go ahead and start registering for training. There's the website on this slide to visit Medicaid if you have any additional questions. And once you attend the training, you can go ahead and request a device and begin using the device so that you can sort of work out any glitches prior to it going into effect August 5th. For technical assistance, unfortunately, reaching out to the county board may not be entirely effective. We would love to be helpful, but it's out of our system. We don't have the view of the SANDATA or the EVV. So your best link to go to help is calling the EVV provider hotline at 855-805-3505 or through the help desk email. For general EVV questions, there's the EVV@medicaidohio.gov. That is also a good contact. And I just want to thank you for listening today, and that is about all that we have. Thank you.